Welcome to the Buzz Podcast. I'm your host, Mike Mosquito.
And I'm Maureen Nylene.
The Buzz Podcast is where business, technology, and innovation collide. It's where we deep dive into candid conversations with leaders who are pushing the boundaries in healthcare, technology, and beyond.
It's also where you're going to hear industry experts who are rewriting the rules, and in some cases, they're breaking them. So don't forget to join us for each new episode and like and subscribe to the Buzz Podcast.
Hello, everyone. Welcome back to The Buzz, where we deep dive into the latest in innovation, emerging technology, and healthcare. I'm your host, Mike Mosquito, and joining me as always is my fantastic co-host, Maureen Nylene. Maureen, how are you?
I am good as always, Mike. Again, so excited to be here and excited for the conversation today, and we've got so much ground to cover.
Well, absolutely. And today, guys, we have a great and wonderful special guest, Ryan Bengtson, CEO of Panda Health. We're going to talk about the journey that Panda Health has gone through, their origination of a company, the platform that they offer, and we're going to delve into some key topics. What makes healthcare special at Panda? Ryan, welcome to the Buzz.
Thank you, Mike. Maureen, very much appreciate it. Great to be here and look forward to the conversation. So thank you for having me.
Well, that's awesome. And so let's just jump right into this. Ryan, today's market has a lot of companies coming on board, coming online. Yep. How did Panda come to be? What inspired its creation? Why are you there?
Yeah. Well, origin story is always a great place to begin. So, Panda was born out of a few health systems that came together and were struggling with a need that they had, and that was their own digital transformation. In one example, one of our founding health systems had started going down this path and I can't remember what the first category was, but they found that it took them almost 18 months from the time they identified the needs that they had, did the market research, did the demos, found the vendors, contracted, and made a selection on that process or on that product. Not even implementation. That was just getting from identification of need to making a decision. And they realized that that pace was not going to be sustainable if they were going to keep up with the pace of change in the industry. And so these organizations came together and said, we need a better way to understand what is happening in the digital health space. How do we keep up with the changes? How do we make sure we've got the resources to sift through the noise and find those solutions that can actually deliver value and address the needs that we as an organization have? And so this basically started out of that clearly defined need, and our role is to fulfill that objective. So we work on behalf of our health system members to really define and understand what's happening in the market, what are the best solutions out there to address those needs, and help them work through their own digital transformations in a more confident and more accelerated manner.
I love that.
Yourself, how long have you been in the industry, Ryan? I'm sorry, Maureen. Talk to me.
I've been in healthcare now a little over 25 years. So I spent right around 20 years doing clinical and strategic consulting for Accenture and Huron Consulting Group. Back in 2015, left and started focusing on the digital health space, initially with a company that did predictive analytics related to social determinants of health. We had a successful exit there. Did a little bit of additional work in the digital space around remote activities, initially with some software implementations, and then looking at remote cardiology programs and things of that nature. And then got introduced to Panda as a former colleague of mine was working on the kind of beta pilot and Inception phase. And when they decided to make a go of it as a company, I jumped on board.
Nice.
That's fantastic. What I love about it is just the diversification of background that you bring. And so as I'm sitting here listening to your origin story, I'm thinking about really, it started as an organization seeing the gaps, and then that transitioned over to really forming a company that also sees the gaps. And so it just is a natural path then to help more organizations, as you said, clear that noise out. So then I'm thinking the hard part must come next, right? Because you've got this great idea and you see that there's a need in the market. But then you actually have to figure out, how do you differentiate yourself in the marketplace? So what'd you discover in those early stages when you were just launching Panda Health?
Yeah. No, we got everything right out of the gate, and it's been, perfectly flawless execution from the beginning, right? Isn't that how all these companies work?
I love it.
Um, no, I think the thing we first discovered was we were too transaction focused. So again, these health systems were looking to identify and select the solutions that would best enable them to move forward. And Panda tried to jump in at that point, which is, how do we help you identify and procure these technologies? And what we came to realize, and it should have been obvious, but we all have lessons learned, is that these organizations, the purchase itself is 10 or more steps forward in the process. You first have to do the research and understand the background of these organizations, and really understand what your own use cases and needs are, and how does that align with your existing tech stack, and all of those components. And so we had to do a relatively significant pivot a little ways into our journey to move more upstream from just being a contract catalog or a transaction engine to really being a market intelligence platform, bringing together our members and community, and helping them learn from one another, and really allowing Panda to establish that trust as a digital health expert and connector, and then walk with them through that process. And we do still ultimately land at a transaction. Maybe we determine that the right answer is to leverage a solution they've already got in house, or that it could be done via their EHR or some other product. But ultimately, it was moving more upstream and being a better intelligence partner and trusted agent on their behalf.
And that's, again, you want to be that trusted authority that these buyers in healthcare that they can come to. And that's great that you identified that you had some strengths in some areas, and you're trying to be that strength for a purchasing or procurement or an education of a technology that's hitting the market, because a lot of folks don't have time to do that discovery and do all that back end work. So you're bridging that gap. Let's talk about the platform itself.
Yeah.
What do members get for coming onto the Panda platform? What do they receive? And what is that
Yeah.
experience like for someone that's never done this? We've had GPOs and things like that in the past. Talk to me about the Panda experience if they come
Yeah.
onto the platform.
Yeah, I think it's very distinctly differentiated from a GPO, and in part that's because of the complex nature of the purchase, right? These aren't commoditized items; they're complex purchases, and require a lot more information. So what you get as part of the Panda process, we really look at our model or our platform as having three legs of the stool. So one is just deep market intelligence and research on categories of digital health, the vendors themselves, the solutions, and that includes information security evaluations, demos, reference checks, a whole competitive analysis, understanding where they're currently deployed, and who's using those products. A lot of that information that's hard to gather. You need to go to multiple different sources. We can aggregate that. So I think that's step one, is really having a very robust knowledge base of digital health broadly. The second leg of that stool is as we increase more members, we also have a deep understanding of what their individual tech stacks look like. So we know, we've got large academics, we've got, large integrated delivery networks, we've got small community hospitals, and we understand which EHR are they on, what other digital solutions are they using today, which ones play well together and which don't. And so, it's akin to benchmarking, where if we have an organization come to us and say, here's what I look like, and here's the problem I'm trying to solve, we can go into our membership and say, we've got two other organizations or three other organizations, whatever, that look exactly like you, and here's how they solve that problem, or here's how they're seeking to address that problem. And so there's almost that reference database, if you will. And then the third piece of that is really the community and the relationships that exist. So we all know that in general the health systems are not going to trust the vendors directly. They do trust organizations like Panda or Class or others out there that are providing unbiased or at least intentionally unbiased research, but they most trust their peers and their colleagues in the industry. And so we create an avenue through the community aspect of what we deliver to bring those members together, give them forums and roundtables and networking events and opportunities to connect with their peers, and understand, again, how are they solving these problems? What challenges did they face? Because, none of us have to be on an island, do this ourselves. Very rarely is somebody doing this. Only one person does it for the first time. At that point, we should all start being able to learn from one another. And so that's our goal, is to bring that community knowledge together and allow our health systems to learn from one another as well.
I've said that
I like
before.
that.
I like that. And I've said this on stage not too long ago. Why don't we learn more from each other?
Right.
Yeah.
Hospital A has this great implementation of a solution. They should be sharing that implementation methodology, who they used, some regards, how much did you pay for it based on your number of bed size, but help the community understand that you should follow these great implementation stories and use them for yourselves, because most of the times those hospitals need those solutions too. They just don't want to take
Right.
the time to go through the evaluation phase of understanding what does it take, what are the gotchas. Here are the gotchas. Here are the potholes. Here's how you walk around them. Here's how we stepped in a few of them and didn't know.
Right. Right.
Right?
Hmm.
And so
Yeah.
Nope.
that
Absolutely.
should be the new ship or paradigm. But I promise you, most compete. And I said on stage, I caught myself after saying, I'm like, are you just waiting in competition for someone to die across the street so that everybody will come to your hospital? Is that your marketing plan? I caught myself after I said it. But I said,
It's an awful marketing strategy, by the way. That's awful.
it's an awful marketing strategy. But you got to think, why don't we share more? I've talked about a couple of CIOs that are out there that are bleeding edge, that they talk about being collaborative in this way and how to open up on the best tools that are out there for their organizations. So
Yep.
I think,
So, okay, but hold on though, Mike, because at the end of the day, I still feel like you're going to have organizations that are going to say, oh gosh, that works, but that would never work at my organization because, we don't have the resources or we don't have the capital or we wouldn't have, there's a multitude of reasons why I think every organization thinks that they're unique. And so I kind of want to piggyback off of what Ryan was saying earlier. You've got a composite of organizations that have done the work previously. And so you can say, hold on, let me pull from that network to help you get there. And this organization might be resistant. So how does Panda really kind of take into account that resistance, but also the uniqueness of the organization so that you can say, this solution is a good fit for you?
Yep. Yeah, and that's a fair question, right? Every organization is unique in some aspect. But I think we also know, having collectively been in the industry for many, many years, that there's a whole lot of commonalities and similarities and folks dealing with the same challenges. And so I think that's where we really try to find that common ground. We work very closely with our member organizations. We've got over 40 health systems now and growing. And we work very closely with each of them to understand, what are your strategic priorities? What are you trying to accomplish as an organization? Some of those, very distributed rural populations, some, very compact urban centers, they're going to have slightly different needs. Their reimbursement challenges may be different. Their, geographic challenges are different. But at the end of the day, we're all trying to solve the triple or quadruple or quintuple aim and, address those key challenges. And these solutions are really intended to do that, to help you with, your own clinical staff and their effectiveness, to help you with the financial stability, to help with, quality of care and outcomes and things of that nature. And so we really focus on that commonality. You're looking to solve this problem. We've got several other organizations that have gone ahead of you and have addressed that look similar to you. Are there going to be differences and nuances? 100%. Let's sift through the noise and help you find the solutions that might work best for you based on those commonalities. And then these organizations are still going to have to make the final decision and do some additional due diligence related to their unique circumstances. But you've still accelerated that process by, months by having that accelerated starting point, as opposed to starting from scratch and just believing that we're so unique we can't possibly learn from anybody else. That I think that's a unique form of hubris that is fading in the industry, but it still exists.
Yeah, for sure. For sure.
when they do exist, I will tell you that uniqueness comes more into play when you have a shop that's a build shop as well as a buy. So they have their own development shop, and and,
Yeah.
and I can build it better than any company out there could ever, because I know we're so unique that we need to build this technology ourselves. And
Yep.
so
Yeah.
we got these healthcare systems out there that are capable of building their own technology. There are some that are out there, There are some that fail at it. We know a few of those names out there. We won't call them out on the buzz. That's not what we do. But they own their own development shops and creating in house. From your perspective, talk to me. What does success look like for these organizations that are willing to build, to take that leap off and say, we can develop
Yeah.
from a, from a pan
Yeah.
standpoint?
This is an area of focus for me a little bit because, again, if you go back to our origin story, part of it was for Panda to help sift through the noise that's out there. And we all saw and still continue to see so many new entrants into the space. Some don't come from healthcare, but they're attracted by the 20% of GDP number. Others have been in healthcare for a while and are looking to expand, and that's great. And a lot of these are very good, viable solutions. Some of them may just be building, to get a flip and get some revenue. But there's a lot of noise out there, and I think one of the things I struggle with is some of these well-intentioned health systems that are inadvertently contributing to the noise because they have their own development shops. And don't get me wrong, there are plenty of successes out there. And of course, we all know about the successes because those get touted. There's also a whole lot of failures out there that people love to not talk about. And so you get this biased perspective that, oh, it must be easy to open your own dev shop and build these solutions because I hear about all these other organizations that have done great and had spin-offs and commercialized it. I think the reality is there are a select few organizations that really have invested, have the scale, have the resources, and have proven commercializable, in-house development solutions. I think what that has spawned is a lot of other organizations saying, we should do this. That's revenue diversification. It's an opportunity for us to, get into this space. And then, Mike, going back to your comment about uniqueness, we look at the market, we see there's already a dozen solutions that do it, but none of them do it exactly the way my organization wants it because of this one nuance. So instead of what I think a lot of those organizations would be willing to do is partner with a health system and make those adjustments and kind of further develop their solution. Those health systems just branch out and say, I'll develop my own, and you now end up with a 14th or 15th solution that a lot of times is very specialized to their unique needs, and then the converse of that is it's not very commercializable. And so what does success look like? I think it's really having an honest conversation of what is the investment we're making in this? What is the differentiation that's going to be provided to our organization versus what's already commercially available? And is this really a solution that would be commercialized elsewhere? I think in a lot of cases, a partnership model with an existing vendor to create some, co-development work. Maybe you get an equity stake or, get some discounts for doing that. But I think that would be far more valuable and really take a lot of the good solutions that are out there today and make them better, as opposed to potentially contributing to increasing the noise.
So you really just kind of take that conversation and elevate it to say, listen, that's great work that you've been doing in-house, but I recognize the complexity that brings. Have you considered that there's an external partner that you could engage with that would be, a bigger bang for your buck than just continuing to do the development in-house? So I'm assuming, though, then that you're continuing those conversations with them just to help to build that best strategy for the organization.
Very much so. It really, like so many things, is kind of a build by partner type conversation, right? So a lot of the organizations we work with may be smaller, less resourced, and they really don't have the ability to buy or to build. So then it's, okay, is this a buy or is this a partner opportunity? For those that have dev shops and have already made that investment, now you've got to have kind of the ROI conversation of, all right, is this really the best category of digital health or the best area that needs a new solution, or do you have sunk costs and you're trying to keep those folks busy? And it's a difficult conversation, right? I mean, the investment's been made. They're wanting to find those successes, but yeah, really drilling down to what are the needs, who's out there, and maybe this is a partner option much more so than a build option, just given the solutions that exist today. In some cases, you're going to find, if you think about the Gartner hype cycle or some of the evolution of these solutions, you're going to find newer products, less options in the market today, less sophisticated or less mature, yeah, that may be a real good opportunity. Again, if you've got the scale and clearly defined use cases and needs to go out and build your product. So we really want to work with our members to help them make those decisions as informed as possible.
And there's got to be a value proposition there too, right? With the timing of development and deployment. Well, let's shift gears a little bit and talk about that aspect of timing, and the value proposition for a health system to deploy a solution today, as opposed to waiting on the EMR provider to develop that solution in the future. Right? I've got
Yeah.
something on the shelf. I have a need. I have a patient need. I have a clinical need. It's sitting there, but there's a roadmap that we've bought and been told at our latest conference that is going to be on the roadmap in the next X number of cycles. How do
Yeah.
you feel about that?
Again, a common challenge we see. I think, there's two extremes, right? I mean, on one hand, you've got we are committed to our EHR. We've already spent hundreds of millions of dollars. And so we are going to do nothing that exists in the EHR or is on their roadmap, regardless of how far out that is. The other is, what I think of as the shiny object syndrome, which is you're always going after whatever the newest, hottest, exciting thing is. And, you're already building your whole AI strategy shop and everything because that's the latest thing on the hype cycle. Honestly, I think, either one of those dogmas is a little bit too extreme. I think the reality is most organizations are going to benefit by being somewhere in the middle. On one hand, if you're waiting on your EMR for some of these products, these organizations know that, the first, second, third iteration of what the EMR is going to produce, we don't know when it's coming specifically. We've got as you said, Mike, X number of cycles, but we don't really know when it's going to be released quite yet. And we really don't have a sense of how good is it going to be. So you're kind of betting on that, and eventually it might get there. But in the meantime, how many cycles are you losing, and how many other quality products are out there already? And you could be missing out on, the financial benefit of that solution, or the community benefit, or the outcomes and quality for patient safety and patient care. And so there is, again, going back to your point, an ROI to that of how long until we really think there's going to be a quality solution from the EMR, and what is the gap between now and then, and understanding what the technical debt is to get to that point. In a lot of cases, you may go get a point solution today that is very effective, is going to help drive a lot of that benefit, and then you can continue to monitor. And when the EHR catches up to where you want or need it to be, there can be a changeover. Now, if that's going to be way too much investment and integration for the current technology, that factors into that decision. But in most cases, especially with today's technology, so many more of these are done through APIs and more simple integration. Not no integration is ever as simple as it's supposed to be. I think we all know that. But easier integration, that technical burden isn't there as much for the change out. It probably comes down more to training and the human change management aspect of it. But again, I think you have to weigh that against the benefit you can achieve versus how long you have to wait for the EMRs in some cases to get to that same level of maturity and capability in those areas.
Yeah, and those are tough calls. And I think, oftentimes organizations get stuck in a state of decision paralysis because they feel like they don't have the right information to support what they really need to be doing next. And it sounds like there's an opportunity then for Panda to work with them to help them with that decision making, to weigh those risks, to weigh the benefits. But you also do something a little unique because you've got something called rapid background intelligence. And I want to know more about that.
Yeah. Yeah. So again, that's the ability to kind of go in and really understand, and it's through the platform and the data and the community, those aspects that I mentioned earlier. But it's the ability to very quickly go in and understand, what is available in the market today, using those tools in the community to get a sense for what is the implementation burden that is required for those solutions. What is the ROI that you're receiving? Not just what does the case study say that's published on the website, which is always going to be, very favorable ROI, but
Right.
what are you really seeing? How long did it take you to implement? How hard was the change management? And those components that we can get from our community and use that as input to making that decision. So, and again, some of these organizations are very locked into, we're not doing anything on the HR, but at least opening up that conversation to say, here's what another organization that looks similar has done.
Mhm.
yes, there's going to be unique aspects, but does this provide you with some level of rapid intelligence and conviction to go to your internal committees and say, hey, this might be worth looking at. There could be a value here that we're missing out on. Obviously, it doesn't unlock the door every time, but I think it provides those decision makers the tool set they need to come in and at least be able to make a case and have an informed discussion. As you alluded to, there's just so much difficulty in getting that information or having that knowledge that a lot of these decisions are being made, devoid of good intel. And in those cases, the safest thing is, well, let's just wait, right? It's never the safest thing to move forward. It's always the safest thing to just wait. And so trying to give them the ammunition they need to feel confident in making a move forward type decision.
Mhm.
So, with that being said, and trying to make those decisions, I've noticed something unique about Panda and how you help them, and that focus on personal growth and community engagement is key. How does Panda foster that aspect among its members? How do you pull that
Yep.
together?
Yeah. So what we found, and Mike, you're probably very familiar with this, and Maureen, you as well. A lot of the CIOs out there have, their buddies in the industry that they've got, a text chain going with that they can reach out to and ask questions, but they may be their buddies in the industry, but not necessarily those that have a health system that looks like them or is best equipped to kind of be a point of comparison. And it's very difficult to go back and check a group text message on your phone to actually find data and intelligence and that type of information. So one of the things we've done on our platform is created a forum for our members to have those types of text exchange, but it's searchable, archivable, and allows you to reach out to far more than just the phone numbers that you've got. It's basically our full community as that continues to scale. So one aspect is really replicating kind of that personal network, but in a more codified way. And then, as I mentioned earlier, forums and roundtables, networking events. So we will have a health system come to us and say, we're really interested in this. What can you do for us? We'll search the rest of our membership, and lo and behold, there's 3 or 4 other organizations maybe that haven't gone before you, but they're all dealing with this right now. Well, let's bring that group together. Panda can provide some education on that category based on the intel we have, and you can almost create these sub collaboratives, if you will, that can then proactively learn from each other while they're going through the process together. And so I think it's that codified communication, it's the discussion forums, then of course whenever we get together at any of the number of industry events, bringing those individuals together, helping foster that relationship development, that trust, and that growth. Obviously there's younger CIOs out there, there's more experienced senior individuals, and so creating some of those mentor relationships and development relationships. And we've already seen in a couple of cases where we've helped folks connect on looking for new job opportunities or new opportunities to tap into things that they haven't had exposure to before. So I think the CIO role and IT in general can be a little bit lonely within healthcare because you're trying to juggle so much and you're at the center of what's going on, but you're not really that clinical resource. You're just trying to keep everything else running. And so I think those shared experiences and that collaboration is very important in the space that we're in.
I love that. It's really about, as you said, creating a community of like minded individuals. And so I think just the opportunity that Panda creates is more than just about the technology. It's about the relationships and the networking. And in turn, that's just going to yield better innovation and collaboration within healthcare, right?
Yeah. Yeah, absolutely. I mean, I think that's a key differentiator for us. And again, I think it goes all the way back to our founding. We were founded by health systems to address a challenge. We weren't, a new industry entrant. These were health systems that backed us and said, we want to solve a problem that is something that we have. And it was started out of community. It was 3 health systems coming together and saying, we all are having this problem. How can we solve this for more people? And so I think it was at the very inception of Panda, and it's a key differentiator for how we look to scale our organization today.
Well, Ryan, this has been an enlightening conversation and discussion with you today. Thank you for sharing the Panda story. It's been great to hear it and offer such valuable insights to our listeners and talk about the challenges and opportunities that are facing our health systems today. So I'll thank you for sharing that with us. It's important.
Yeah, no, again, thank you guys very much for the opportunity. I love what you guys are doing and the role of the Buzz podcast. And so very much appreciate the opportunity to be a part of it. Thank you.
Well, we're thrilled that you joined us today. And to all of our listeners, if you're interested in learning more about Panda Health, and you should, or want to explore how they can help your organization, make sure to check out their website. You can go to panda.health.
That's right. And thank you today for all of our listeners to listening for this episode on The Buzz. Don't forget to subscribe, leave us a review. Maureen and I are looking forward to hearing from you out there. Follow us on social media, and more insights and episodes are coming to you soon. Until next time, keep buzzing with innovation. We'd also like to thank our sponsors, Panda Health, Elite Groups, and Natera, for joining us on this ride. Until next time, thank you.